Welcome. This is dedicated to Liam, his family, and anyone who has questions or concerns about autism. I will share some research, my thoughts about the information Liam's family provided. I will share my experiences with past autistic clients. So let's begin. So autism is called Autism Spectrum Disorder. So you can also call it ASD, but it's a neurological development disorder that affects how people interact with others, communicate, learn, and behave. Although autism can be diagnosed at any age, so autism can be diagnosed at any age after proper observation and some possible tests. Although it can be diagnosed at any age, it is described as a developmental disorder because symptoms generally appear before the age of 2. According to the Diagnostic Statistical Manual, or DSM, the fifth version, there's different versions. The Diagnostic Statistical Manual is, or we call it DSM, the DSM 5, which is currently out, is a guidebook or for psychologists or counselors, therapists, for them to basically look up different, or just use as a guide when they're doing work with clients or they're doing counseling. It just can maybe give, like, refresh our memories of certain disorders, or it can help us just with like making assessments and then passing those assessments along and doing clinical assessments like that. So there's different books in different medical fields. Psychology, it's the Diagnostic Statistical Manual. Okay, and it was created by the American Psychiatric Association, so APA. So it's for healthcare providers to diagnose mental disorders. People with ASD. Now, this is not something that's inclusive because a lot of autism, as we understand it right now, is evolving. It's not set in stone. There is certain commonalities that are associated with autism. So, but it's on a spectrum. So it's not like 1, 2, 3, 4. It's more like it kind of can change and shift. It's the science is not clear yet. So it's on a spectrum. Okay. So please remember that. So people with autism have difficulty with communication and interaction with people. So they will have difficulty in a lot of social settings to be appropriate or know how to, or even wanting to interact with others. So especially in new environments. So for example, the information that Liam's parents gave to me, or family gave to me, is that Liam does socially interact with his with other peers or other kids, other playmates. So he interacts with them and plays with them and does a lot of things like that. So that does not mean he does not have autism, because there needs to be a lot of observation. This is not something that just after one visit to a counselor, a therapist, psychologist, or doctor, and a good doctor would not just try to say yes and answer the parents' concerns or their questions that he does have autism. That's not that's not the appropriate way to go about it. You need to have lots of observations, and there's different tests and things like that. There's blood tests that you can do to find out if there's any genetic markers or signals that would let you know that possibly autism is present. So, but we will talk about that a little bit later on. Okay, so there's a lot of difficulty with social interaction or just playing, talking with parents or playmates, different kids. Okay, there's restricted interest and repetitive behaviors. So this restrictive interest or repetitive behavior is, for example, I worked with a client and he loved to play with cars. I worked with him for more than a few years. And so he was younger, maybe 12, maybe about there. This was some years ago. But he loved cars and he learned everything he could about cars. He was fascinated with cars and he loved them. So he would talk about them a lot and just fantasize or daydreamed about cars and things like that. So his interest was very restricted to cars and just playing with them and drawing or watching different things on TV. And he was not at the higher end of the spectrum. He was more in the middle of the spectrum. So, and I'll talk more about him later. And repetitive behavior. Repetitive behavior is something that you would see the child do often, or an adult often. You would see them maybe do something like with their hands, do something often. So this is something that they would do just repetitively. The one client I worked with that was very interested in cars, he did things like this. Some children or adults, they would do maybe rocking, or there's different things. So not all children, of course, are not the same. So we cannot, when we're looking at autism or our children in general, it's not always a good idea to compare. So it's not a good idea to always compare your children because children develop at different rates. They're different stages. Some children, because they have brothers or sisters, they can develop quicker. They can be a few steps ahead of other kids. They can start walking early. So these are things to keep in mind when you're thinking about your children or you're talking with friends, relatives about children or teenagers, adults, or whoever it be. So these are things to keep in mind. It's okay to compare, but just keep in mind that comparing is not always an answer. Okay. So there are symptoms that affect their ability to function in school, work, and other areas of their life. So you would think that if they're having trouble socially connecting with people, being able to hold conversations, being able to have their emotions presented or displayed in a way that's appropriate for the culture they live in, for example. Okay, now, as for Liam, based upon the information that his parents provided me, his behavior seems to be appropriate for his age. And some children are different. Some children are quiet. Some children are a little more shy or sensitive. So we have to remember this. Liam is a developing, growing boy. As parents and family members or just caring people, we want to try to help as quick as we can and as soon as we can. But when it comes to mental health, things take time and we cannot rush this because we don't want to, one, we don't want to have the child doing something that's a detriment to his evolution or his growth as a child, as a human being. We want to do no harm to the child or any client, any person, in someone that is in the mental health field. Even doctors have this. They are supposed to make sure there is no harm done to their patient. Okay. Let's see. So autism is known as a spectrum disorder, as I described earlier, because there is a wide variation in the type and severity of symptoms people experience. So it varies. So that's one reason why. And as I will tell you, autism and a lot of mental disorders are still being discovered. That, as what I mean is being researched and understood. Human beings are very, very, it's like searching the ocean. There's so much to see, so much to learn, so much to know. There's so much that we can change our thoughts about things, about human beings. This is a evolving, this is a growing, human beings are not stagnant. We are not, for example, a chair. A chair is a chair. There's only so much information a chair can give us about the chair. Whether it's made of wood, whether it's metal, whether it's plastic, whether it has cloth or some type of fabric on it. Human beings are not that way. Human beings, it can take years, a lifetime to know another human being. Okay, so people of all genders, races, ethnicities, and economic backgrounds can be diagnosed with ASD or Autism Spectrum Disorder. And I will leave some links in the video to different research that you can look at or different websites you can check out. Okay, so Autism Spectrum Disorder is a developmental disability caused by differences in the brain. Some differences in the brain, meaning that there is maybe different chemical imbalances, or maybe as that maybe are not, there may be even different things in the brain that are not firing or like picking up or being able to send messages across, so the child or person can know how to respond or act or do different things like that. Okay, and a lot of other causes are not known. It's evolving, there's a lot to learn. And scientists believe that there are multiple cases of ASD that act together to change the most common ways people develop. So people with ASD or Autism Spectrum Disorder behave, communicate, interact, and learn in ways that are different from other people. There's often, a lot of times, there's nothing you can physically pick up. So often, not always, but as you look at another person walking by, it's not something like Down syndrome that you would know that there's something physically different about them. And that's one example. So autism, it's more of a thing you have to, it takes time. Again, it takes time to be able to observe someone, a child, especially if they're on the lower end of the spectrum. If they're on the higher end, maybe it will be a shorter period of time to be able to say yes and making a proper assessment or proper observation and give that information to the family and say, yes, the child does have or presents autism. And these are the resources that should be followed next, or the appropriate steps to take for a family to start to try to help the child just live and have depending on where they are in the spectrum, have a better living situation for life and make things easier for the parents as well. So there are abilities of people with autism spectrum disorder, or ASD, that can vary significantly. For example, some people with ASD have advanced conversation or conversational skills, so they can hold a conversation about topics, about different topics. For example, the client I work with could tell you lots of things about cars and trucks, can tell you all kinds of things about automobiles. And he can tell you things I don't know about automobiles and cars because he watches videos all the time. He watches a lot of videos and just plays with the toys of the cars and draws them. So he learns a lot about them. Someone can have that, or maybe they can have advanced conversations about art or things they remember. They can remember a lot of things and tell you very detailed, like what they experienced in the past moments, and they can tell you a lot about that. So there are some people that need a lot of help. So for example, there was one client that I experienced that still needs help today. So even basic things like using the bathroom is something he struggles with and has to wear like an adult diaper to basically make sure he doesn't urinate or defecate upon himself. So that's at the more severe, and his communication skills are severely, they're not really there. He makes a lot of sounds and things like that. So he needs like lifelong help, and that's more at the severe end. Even when his parents pass, somebody's in the family, somebody will have to take care of him. Okay, let's see. Some people also maybe need no support or very little support, and they can have a job. They can be able to go back and forth to work. They can go different places. They can do shopping for them. They'll struggle a little bit at keeping their money together or budgeted. So they may have little struggles like that. But they're able to function and do things, have simple jobs and stuff like that. Okay, but although, and this is also a thing too, that some people with autism spectrum disorder can improve over time with proper help and support, especially if they have a family that supports them a lot. That can help at times, and especially people that, even if they're at the higher end, family can help support. At the lower end, it can help a lot too. It just depends on where they are in the spectrum and how severe it is. And with Liam, Liam is a growing boy, and at this point, there needs to be a lot more observations to be able to say anything positively about him, whether he has it or not. And for one example I'll give, in his home, his family, they speak about 4 different languages. Now, this is with any child that has multiple languages in the home. If you're wanting your child to speak a particular language, or the main language for the child you want is, for example, English. And if there's 3 other languages in the home being spoken, and this is since birth, since Liam is now, he's still very young. He's barely 3. So he's still trying to understand which language is going to be the dominant or the main language he will use in the home. So this is one thing parents will need to do if they speak different languages a lot. So they need to, for their children, they need to decide, and based upon the culture that the family lives in, what is going to be the best language for the child. What do they want? What do they want for the child? If English is the language, then English in the home needs to be the more dominant or main language. So that does not mean you let go or you don't teach your child the other languages. That's not. It's up to you as a parent or family, but it would be more of an asset for the child later on in life to have those other languages. So it's a good thing. It's just pick or use a language that you want the child to use in his life or learn first to get really good at for school or whatever it be. Pick that language. If it's English, use English more often, but don't forget whoever mother tongue, if it's Tagalog, or in Liam's case, Tagalog, if it's Basayan, if it's Norwegian, I think the father. So there's all these different languages. That can also be one reason why Liam's a little slower with language, because he's hearing all these different languages and he's not sure which one to use. So this is one thing that I discussed with his family, that they may need to pick the main language for the home, so Liam will start communicating more in that way. So Liam does communicate. He will go to his as the information that I received from his parents, that Liam goes to them and he basically non-verbally communicates or slightly communicates with them and tries to tell them what he wants or things like that. So he is communicating with them, but in his own way. He is saying some words, but just not conversations or at maybe a typical level for a child of his age. But that does not mean that he has autism. There's more information needed. There's more observation. There's more to see. So this is one thing. Okay. And so children with ASD can show symptoms within the first, depending on where they are in the spectrum, the first 12 months of life. So if they're on the higher end, within the first year, they can be diagnosed with, or they can be assessed or observed for autism spectrum disorder. And then the appropriate actions can be taken for the parents, or the appropriate conversation can be held. A psychologist or doctor should never just immediately, in mental health field, depending on the situation, but should never just immediately, in my opinion, immediately say, yes, he has this disorder, because this is very hard for families, and this is a big impact upon the family. So we have to be very careful and do no harm. Okay, so and some children may not show any symptoms up until 2-3 years of life. This is not set in stone. So as I said, this is still an evolving disorder. Psychology itself is evolving and learning, growing. We're dealing with human beings, so human beings are not stagnant. Okay, and but this is a kind of typical thing. And some children with autism spectrum disorder gain new skills and meet developmental milestones until maybe up to about 2 years, and then you start see maybe a regression, or a like they maybe will start to go back on some of the milestones that they made, or they will reach a certain level and then drastically slow down and not make the next milestones. So the milestones are like, for example, crawling, walking, babbling, or like baby talk, things like that. Those are milestones, for example. Okay. And so as they get older and they start becoming school age children or adolescents or teens or adults, they may have problems with basically communicating. So social skills is a big problem for people with autism spectrum disorder, depending on where they are in the spectrum, depending where. So some not as bad, some there it's very difficult. And they may also have comorbidity, or they may have other disorders, maybe like anxiety, depression, hyperactivity. So they may have other disorders too. So this may go with it. Okay. So signs and symptoms. So we all want to look for signs and symptoms, but be cautious, because these are children. They're growing, they're developing. The world is new to them. So we have to be very careful about what we say and what type of, if you have friends or family members, be careful, because with young children and parents, especially parents that care, like Liam's family, they care, and their child is young. So there's a lot of positives that the family is looking for his life as he develops. There's a lot of things that they're, hoping to do with him. So to say or speak things that cause stress for the family or make them worry is not good. We have to always remember that we all need to take care of each other, and we all need to be concerned, especially when it comes to something as important as a mental health disorder. Okay, so we have back here, lost my place. So signs and symptoms. So there is a list. A lot of this has to do with social skills. So social communication, interaction between, or interactive behaviors, or interaction between peers, things like that, parents. So some of the signs and symptoms. Now, don't take these as these are, that's it. I'm just presenting you some information. This is not all. Okay, there's lots, but I have to give you something. Okay, so making little or inconsistent eye contact. So eye contact's one thing, but as I said, they're on a spectrum, so some of them can, or maybe eventually they do. But little or no eye contact is one marker. Appearing to not look or listen to people who are talking. So this is one thing. But be careful with this, because children do this. If they're playing with something, children, their imaginations are growing, and they're just in their own world sometimes. So you may call them 5 times before they actually answer you, and that may happen a lot. That does not mean they have autism. They're children. They're playing in their own world. Even as adults, if we're caught up in work or some type of, we're doing something, we might not hear somebody call us 1-2 times. So remember that. Okay, and in the case of Liam, he still listens to his parents. He responds. He interacts from based upon the information they have given me. So Liam's parents, I talked with them, and he does respond, but sometimes he doesn't. It's normal. It can be normal for a child. So don't get too excited if your child isn't responding. Doesn't mean it's autism. So infrequently sharing interest, emotions, or enjoyment of objects or activities with others. So they are more independent or very independent, and they don't interact. So this goes back to the whole social thing. So people with autism may have very little interest in interacting with others. They're perfectly happy by themselves. So this is one thing. But again, some people and children are more, they're more, they're okay by themselves. They're not like some could be, you could say introvert. Some can be an extrovert. So those are things we have to remember. We have to be careful about saying things or putting labels on others, because they can hurt people or hurt families that are, excited about their children. In Liam's case, for example. Okay. Not responding or being slow to respond to one's name or other attention. If you're wanting to get someone's attention, they may not respond. Okay, have difficulties with back and forth conversation. So this, again, the social skills, conversation. They have problems with having a conversation, or a conversation that allows pauses and gaps for someone else to enter the conversation and there be a conversation. So instead of only one person talking and they're just, if you try to say anything, it's like you didn't say anything. They just keep going on to their conversation. So it's like a one-sided conversation. Okay, display, let's see, often talk at length about a favorite subject without noticing others are not interested, without giving others a chance to respond. So they can talk about things. If you're not interested, they won't pick up on those nonverbal emotions or those nonverbal looks that I'm not interested in what you're talking about. Like, I have something else to do, but they will not pick up on that. Now, there are people that do not have autism spectrum disorder, and they also might not pick up on this as well. If they haven't had, for example, a lot of friends or things like that, they may not pick up that people aren't really wanting to talk to them. So, but it does not mean they have autism spectrum disorder. For example, the client I worked with a while ago, he would talk about cars and things, and he would just talk about this topic, and maybe other people weren't interested, or his mother sometimes would come and you would have counseling sessions together with them, and we would talk about the boy, and there'll be times he's talking and you can tell she's like, okay, I've heard this conversation before, I'm not interested in it. Okay, you're okay, I understand, we heard this about cars. So, but he doesn't know. He has more of even the way he displays his emotions or his nonverbal emotions will be pretty flat, even when he's angry or when he's talking about his favorite topic, cars. So there was a lot of times when I worked with him, and if he was angry with someone else, or he would still have this very flat, it's like a flat effect, or not showing. Usually if someone's angry, you can see it in their face. You can see it in the way they move. But with people with autism spectrum disorder, they look the same. They can't, the nonverbal expressions of emotions are very limited Does not mean they can't show any. So they might be able to show even that if someone's hurt that they care, or but it's limited. So now for Liam, from the information the parents gave me, or his parents gave me, he shows emotions. He shows he cares if somebody's hurt. He shows different types or different sets of emotions when he's playing with other kids. So this is another thing, a big thing for someone when you're someone, as for me, when I'm receiving this information, these are different things that are important information. And that's one thing for parents to do. Make sure you, when you're talking to a counselor, therapist, psychologist, doctor, make sure you give enough information to the person, to the psychologist, to the doctor, to the counselor, so they can make a proper assessment, or they can properly start building a narrative or a theme. They can start picking up on themes with the child or whoever it is, adult. So Liam's parents were able to give me information about Liam and displaying emotions. A lot of information they were able to provide. So I was able to start understanding Liam more and picking up on any themes that would make me start to think about autism more in the conversation. Okay. But that was not going on with Liam. He's showing emotions as he should. Okay. So they can also have unusual tone of voice that may sound like a song or a robot-like or flat. One client I worked with, he would make sounds. So it was no type of speaking at all. There was more sounds, just high-pitched sounds he would make a lot at times. And it may or may not be him trying to communicate. A lot of times it was not anything he was trying to communicate. It was just there were sounds that he was making for whatever reason. And other signs and symptoms, they can have difficulty adjusting behaviors to social situations. They have difficulty with imaginative play and making friends. So their behavior, so what it just means by adjusting their difficulties adjusting behaviors to social situations, same thing, not being appropriate in certain settings, or if they're in the movies, for example, it may not be somebody higher on the spectrum. It may not be a good idea to take them to a movie crowded with people because they don't know how to be quiet or sit still or just pay attention. So those are things. Okay. Now they can have restrictive or repetitive behavior. And this may include, this is not all of it. Again, autism spectrum disorder is evolving. We're still learning. And even besides that, it's a human being. Each human being, yes, we have commonalities or a lot of things in common between us as human beings, but there is differences. And at times there can be a lot of differences. Okay. So repeating certain behaviors or having unusual behaviors, such as repeating words, phrases, they can have that happening. They can also have lasting, intense interest in specific topics, such as numbers, details, facts. I gave you the example about the client I worked with the cars. Showing overly focused interests, such as moving objects or parts of a car. For example, the client lived in a facility His mother wasn't really able to take care of him, although he was not at the higher end of the spectrum, more in the middle. So the client that has this love or fascination with cars, we 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 bought for him a model car to try to put together and everything, and that was so fun. That was a lot of fun for him, but there were so many parts and details. We knew this would help him at times, or just allow him to just have some play, or just something nice to do for him. And all the different parts, all the different pieces, he just he learned more and more, and just got very interested in those details of a car. He was already interested in details and could tell you all kinds of things about car parts and stuff, but this was just something fun and exciting for him and good to do. They become upset by slight changes in routine or have difficulty with transitions. Now, this is not completely true. So it takes, now it is true to a sense that changes in a routine can cause any child for that matter to worry or have some type of anxiety about it. Even for us as adults, a change in something can be, we have to take a moment to to adjust. But a child with autism spectrum disorder, they can have a behavior, they can get loud, start yelling, start getting physical. I've seen this with the client that was, at times, the client with that loved cars. He didn't do this often, but sometimes it, he would display this in inappropriate behavior and get very angry quickly, especially with other peers. That would bother him. His anger would go to a level that was a little inappropriate for the situation. Okay, they may be more sensitive or less sensitive to sensory input such as lights, clothing, sounds, temperature. So certain clothing can bother them a lot, and they do not want to wear it. Some boys, like for example him, he hated wearing jeans or pants. Shorts were his thing. Something about just having all that material on his legs was just not fun for him. Something he would not like. Okay. So they may also, and it's light also, as I read just before, light can be, if the light's too bright for them, they can, you know, they can have a behavior because of it. Now, some of them, for example, as long as they control the light, then they're okay. So that's why this is on a spectrum, because it can vary. Okay. Now, people with ASD may also experience sleep problems or irritability. They may also have some strengths as well. Being able to learn, so a strength, for example, they may be able to learn in detail things from a long period. So information for long periods of time. They can remember detail and information that happened 10 years ago, 20 years ago. They could be very strong visual learners. For example, some autistics are at the further end of the spectrum. They can be called, well, depending on where they are in the spectrum, they can be called a savant. And savants can be very artistic, or I'll just use art as an example. And they can draw the most beautiful paintings and the most intricate, detailed art that you maybe have ever seen in your life. They can be very good at this. And that's one thing of autistic or ASD, or autistic children. They may be excellent at math, science, music, art. So that's the thing. They'd be very good at numbers and math. There's this famous movie, and it was about a savant, someone who's it's on a different end of the spectrum of autism disorder. It's called Rain Man. So he was a savant and could do these numbers that are a normal person could not. So, but he has his social skills are not there. He can't socially interact. That's what happens with a lot of those savants that are like, whoa, amazing artist, amazing in math, or recalling dates, going back before they were born and what day it was, what year, or what uh, different things like that. So they they're very interesting. Okay, now causes and related factors for autism spectrum disorder. So researchers, scientists don't know the primary cause. There are some research that points to certain things, but the research is not there to pinpoint or to say, oh yeah, yes, this is it. So it's still evolving. Okay, but there is studies that do suggest that a person's gene can act together with aspects of the environment and affect the development that leads to ASD. So there can be genetic problems. If someone had autism in their family, so Liam's family, based upon the information they provided to me, there is no one in the family that has autism that they know of, or any type of mental health issues. So this was also something. This does not mean just because no one has a mental health issue that it can't be autism. There's so much more, because environment is a factor. So the environment, that there can be environmental factors. And these environmental factors can be anything like medication taken while pregnant, the environment that they're in themselves. So if there's different pollution or pollutants in the environment, that can be different things. So there's a lot of things it could be. Not sure about this, but researchers, doctors, psychologists, counselors, the mental health field is not has not pinpointed something yet for autism to give this information to parents or any family member concerned. So there are some factors that we can see commonalities in it. So having a sibling with autism spectrum disorder. If you have one child, there's a higher chance the other child might. It's not always true, but okay, maybe having older parents, this is not always true as well. So having a child at an older age may, but this is not always true. Having a low birth weight, this can be, but this is not always true. And having a genetic condition such as a Fragile X syndrome. Now, and I also left the link about this Fragile X syndrome. Now, this is not completely, like it's not all agreed upon in the mental health field. So, but it is very interesting, and there is research suggesting this may be a genetic clue or marker for autism spectrum disorder. So the Fragile X mutation, patients can have up to 200 or more repeated expansions of the genetic code. So there's like in our body, so in our DNA that makes up us. If you think of computers, for example, computers, for them to run programs or things like that, they need code inputted into it. Now, just like a human being, in our DNA, we have codes that create our body, create us. So, and those codes are what give information to be like, okay, when you're developing, you're a fetus in the womb of your mother, that, okay, it's time to develop the eyes. Okay, this code is now ready to go to develop fingers. This code is now ready to develop the tonsils, the tongue, the whatever it is, the arms. So now, back to the Fragile X. So where a normal population would have no more than 40 repeats So there are 40 repeats of genetic codes in the DNA. So so they can have up to like 200. They can have more than what's the norm of the repeating codes in our DNA. So somebody with autism spectrum disorder with this Fragile X syndrome that they're seeing. So, and females, so women, can be 2 to 4 times more likely to be carriers of the Fragile X syndrome. Now, you have to think about, for example, a woman has a biological woman. Most of them have 2X chromosomes, so an X and an X. Biological man, or most times, will have an X and a Y. So this is what they're talking about. The X, what it is, it looks almost like an X. So that's why they call it the X chromosome or XY chromosome. So the reason why women are carriers a lot more of this Fragile X is because there's 2X chromosomes for a woman. There's 2. A man has 1. So a woman can have double the chances to carry this. This is why women are a lot of times a carrier. Now there is this idea, or they do see this, that the population that has a lot of times autism spectrum disorder is boys. But as I just read, women are 2 to 4 times in this research that I pulled up that I'm reading for you. So they're 2 to 4 times more likely to be carriers. So they're carriers, but they do not present it. They do not show autism. So these carriers, women, they have children. This is one thing where getting blood tests can come in and to see about this Fragile X syndrome. Now this is research. Not all researchers agree upon this, but this is just what I'm presenting to you. This is new research, and I think it's pretty intriguing, or pretty interesting. So this is when blood would come in to do a DNA sequence. These parents can do this and find out about themselves before they have a child. They can see things like this. Besides going through your family history, trying to get as much information, knowing about your family history, this is why it's important to know about your ancestry, know about where you come from, who you are. Try to go back as far as you can to your grandparents, your great-grandparents, if you can. So, try to know that stuff and pass those on to your children. It can be helpful for them later in life in many ways. Okay, so yeah, you can do some blood work, find out if you're deciding to have children or another child. You can do this to find out about this for autism. A lot of different, you can do some genetic testing for this, and you can find out about a lot of different things depending on where you are, and hopefully if the hospital is able to do that. Okay, so diagnosing of the Fragile X can be using DNA analysis to confirm mutations. It can also be checked in an unborn fetus as well. And this is done so to check a baby within. Now, there is some dangers with doing this. But how you do that is you basically take a sample of the amniotic fluid. So there is fluid within when the fetus is in the womb, there's like a sac around where they're like inside a balloon. And there's this fluid inside there that helps the baby developing, keeping it safe, all these different things. And doctors can use a needle, or they can, whichever way they're going to do it, they can basically rupture the amniotic sac and remove some fluid from there. This can be performed about 11 weeks. of pregnancy. After about 11 weeks of pregnancy, they can do that. Be careful if you choose that. It's up to you, but be careful if you choose this procedure, because not is all known about if there's any adverse effects from doing this, from rupturing the amniotic sac or the balloon the child's in. So be careful when you choose certain things. Get a second opinion if you like. Liam's parents, his family got a second opinion on Liam and how he's developing. And if now the counseling psychologist or psychologist, doctor, whoever they saw before, in my opinion, didn't go through the proper steps and wanted to already diagnose Liam with autism spectrum disorder, and didn't, as far as I'm told, didn't ask questions the way I ask questions when I interviewed them or talked with them. So that right there to me is not a good sign. Or I don't know the reasons why. And to also try to say a child has a disorder and give parents that type of worrisome energy or worrisome message, that's not something personally I would do. We need to see the child more and more, observe the child. We need to get plenty of information. We need to ask questions as a psychologist, as a mental health provider, as a doctor. We have to do these things. Do no harm. That's what our mission is, to do no harm. So we need to ask the appropriate questions, or maybe we need to be trained appropriately or retrained, or maybe not be in the field. Some doctors that should not be in the field, some mental health providers, that's another thing. But we need to, the main thing is we need to find out, and we need to get the proper information and gather that and not come to conclusions right away. That's not going to do anybody any good. And even if a child is at the higher end, the farther end of the spectrum, I may see this, but I will need to see the child more. I need to ask more questions. He could be misdiagnosed. So that's another thing. And so based upon the information given to me, whoever they saw before was not appropriate. And if anyone goes to that psychologist, counselor, mental health provider, should be very careful, because this is a lot to give a family, and we need to be appropriate, and we need to do us in the position as a counselor, as a psychologist, as we need to doctor. We need to be careful doing things. We need to go through, we need to work. We need to do what we love in our field, psychology. We need to do these observations, assessments. This is what we do. This is how we, as again, human beings, there's so much to learn. There's so much to discover. It's like the ocean. To discover the ocean, we have not done that yet. Every year there's new discoveries in the ocean, new creatures, there's new fish, there's always, even in the jungles of South America, in the Amazon, every year, if you can look it up, there's new species found. So humanity is even, I think, more vast than even all the things on earth. So we need to be careful about that. So there is current research that says there's different genetic factors and risks to autism, but it's complex. Having certain genes, having Maybe taking certain medication can cause autism. That's why taking medication while you're pregnant, be careful. Be careful. Vaccines are generally, they're safe. Vaccines are generally safe. However, be cautious. Just be cautious even with vaccines. Be cautious. Just be cautious any type of medication, anything that you're putting into your body while you're pregnant, or even before pregnant, even if you're not pregnant, male or female, whatever it is, be careful. And for treatment, there is no cure at this point. So there's effective interventions that can improve the child's functioning, but for a cure, if you're looking for a cure to just magically have the child be normal like others, that's not there at this point. And maybe we'll see. Can't say never, but we'll see what happens in the future. So there's more just interventions and things that can be done to help maybe make the parents, the family's life easier, the child's life easier. So there are different things you can do, but that comes to talk about those things or to do those things should come after an appropriate amount of observations and information gathering done by the counseling psychologist. So that's what should be done. So Liam, there's still a lot more to learn, and currently I'm not in the Philippines right now. I will be one day. Not sure when, but I will be. And hopefully seeing Liam as well. But there can be some virtual observations we can do, or talking to family, as I did when I talked with his family. There can be some times where, or videos, send a good length of videos, as much as can be sent when the child's playing, interacting, doing things. Videos don't tell the whole thing. There still needs to be a proper observation done in person and over a period of time. But if virtually is the way to get help, then by all means do that. Send videos. You try to give as much detailed history about it, but things like that. So that's how we should go about it as people who have studied psychology, who have went to all the schooling that is needed, or we've done the research, we've had the experience as well. So, and also as a mental health provider, we should not get caught up in gossip or trends. Sometimes doctors, medical doctors, if there's a lot of people coming in with symptoms of flu or certain types of an allergy doctor, for example, if somebody's coming in with a lot of the same, they're seeing a lot of patients with the same allergy, they may rush to just say, oh, it's the same allergy, everybody else is having this, it's the same thing. But maybe it's not. So that's why we have to take our time to do no harm and do things correctly. So for Liam, there needs to be more. I cannot say he does not or he has, but based upon the information provided to me, talking to them for 2 hours, and I've also seen videos of Liam as well, and a lot of it is based upon the information the parents given me. I highly doubt that Liam has autism, although there's still more observations need to be done, and there's more to learn. So that's this video. This is dedicated to Liam and his family, and anyone else who just wants to learn a little bit about autism. So thank you for this. Bye-bye.